Good afternoon, everyone. Welcome to the Westport Board of Health November 14th, 2023 meeting at 1 o'clock, which I am calling to order. A couple of announcements under Mass General Law, Chapter 30A, Section 20F. This meeting is being recorded. And we'll go on to the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're going to move on to the public health nurse presentation with our town nurse, Linda Pierce, talking about COVID-19.
Good afternoon, everyone. So, COVID treatment and prevention this time. We're not out of the woods yet. Like the flu, COVID is here to stay. But we can decrease the vast of numbers in its efforts. Masks are one of the most important measures along with vaccination and prevention. Same rules apply. Masks, hand sanitizing, and washing your hands with soap and water for 20 seconds, and social distancing. The coronavirus tends to spread via droplet from people when they talk, sneeze, or cough. The mystery is who's infected. Someone could be asymptomatic and not be aware. Others could have taken a home test and not followed the rules and inadvertently infected other unsuspecting people. It can't survive on surfaces contaminated with the virus. It can survive for hours or a few days. Clean and disinfect frequent touch surfaces daily. If you have any kind of respiratory systems, please take a test to avoid harming others. Who's at a higher risk? Older adults, people who live in nursing homes or long-term care facilities, and any individuals of any age with serious conditions such as heart, lung, or liver disease, diabetes, moderate to severe asthma, obesity, and chronic kidney disease, undergoing dialysis, having a weak immune system, those undergoing cancer treatments, smoking, and having immunocompromised conditions. Call a medical professional as soon as symptoms start or after exposure. Symptoms: fever, cough, and shortness of breath, which may appear 2 to 14 days after exposure. Get medical attention if your symptoms worsen. A mild illness, stay at home and call your doctor for medical advice before visiting a medical office. Older adults and people who any age with serious underlying medical conditions should call a healthcare provider as soon as symptoms start. Avoid sharing household items, dishes, drinking glasses, eating utensils, towels, or bedding. Wash them thoroughly with hot soapy water. Emergency warnings: trouble breathing, persistent pain, or pressure in the chest, new confusion. Allow the professional to determine if you need treatment. Isolate at home for 5 days if you have not had a fever for 24 hours without medication. Continue to wear a mask if you're going to go out up to 10 days. If a vaccinated person gets COVID, they can still transmit the infection to others. But being vaccinated makes them less likely to be hospitalized or die from COVID. We still have free COVID tests available, so my office is open Monday, Wednesday, Thursday, and Friday from 8 to 11:45, and then again from 1 to 2:30. Please come by and get some COVID tests. The confirmed cases from October 1st till the 28th were 8 new cases, from a total of 49 this season since July. Individuals testing themselves using at-home antigen tests are not included. Case counts represent only a portion of the people with COVID, and you should be interpreted with caution. Westport has seen a small uptick in COVID-19 cases as we enter the fall season. However, we have no reports of hospitalizations or deaths so far. Keeping up to date on the COVID vaccination status and the use of masks in high-risk settings will still help reduce the risk of death, severe illness, or long COVID. The in-home vaccinations, residents who cannot get out of their home, because they're homebound, can get vaccinated in a location scheduled in-home COVID and flu vaccination by going to http://www.mass.gov/vaccines-at-home or calling 833-983-0485. I am still giving flu shots. I prefer that you call to make sure that I'm in the office, because sometimes I am out doing clinics. If you have no insurance, you can still get a free COVID vaccine at the pharmacy or any participating CDC Bridge Access programs, which include all CVS and Walgreens stores. Free telehealth service for COVID treatment with Paxlovid. The state is offering this service to help residents see if Paxlovid, a COVID-19 treatment pill taken by mouth, is a good option. To find out more or begin an online video consult. Free COVID tests still available, and flu vaccines from the town nurse are still available. Our blood drives, the next one will be at January 18th, and that will be held at St. John's Church on Main Road. Please, if you decide that you want to donate blood, please go online and sign yourself up. This is a much-needed thing, and we'd love to see you there. Some of my other things that I do are blood pressure checks, and I have a monthly mom talk for new moms, free Narcan and syringe disposal, and more. If you need a dressing change, I can do that with the doctor's order. And if you have any questions about any diseases, call me up, 508-636-1030. If I don't know, I will definitely look it up and get back to you. And if anybody has any questions?
No, that was great. And it's, I guess, important just as we get into the holiday season, you know, it is timely to be reminded. And if you're getting a COVID vaccine, it takes a couple weeks to take effect. So
that's right.
Get it
absolutely right. Yeah, a couple of weeks. That's right.
Holidays would be good.
That's right. So please don't hesitate. If you're due, get your booster. Very important, and your flu shot.
Great. Thank you very much. Okay, we're still struggling with the lawnmower out there, but we'll have Matt speak loudly. Anything on the written report, questions from board members?
I didn't have any.
Matt, how about your verbal?
Well, everything that I was going to talk about when I just talked about flu and COVID. Other than that, you know, all is pretty good. Transfer station's busy and doing pretty well there. Though the staff is really working hard to keep the place clean and safe, and for the residents and people coming in and out.
Can you remind them what the Thanksgiving week schedule will be?
Yeah, for the Board of Health, it's going to be, we get a half day on Wednesday, the 22nd. We're off on Thanksgiving, the 23rd. And we're also off on the 24th, that Friday. So that's the Board of Health's schedule. And transfer station schedule is they have half a day on the 21st. I believe that's the Monday. Then they're off on Thanksgiving. They're off the day after Thanksgiving, so they'll be open for business again on Saturday. Same schedule every year, year after year, for many years. So, you know, hopefully you'll watch the meeting. Hopefully you'll watch the big lit up sign down at the transfer station, or our webpage has these hours posted now. Otherwise, I really don't know how to get the word out.
So save your turkey bones for Saturday. We won't be open Friday. Okay. Anything else?
Director approved plans.
Okay. Yep. Move on to those.
Just a couple. We have a 2-bedroom repair on a 66,702 square foot lot. It's at 615 Adamsville Road for a John Canane, utilizing a stone bed. This will require a deed restriction. And just so I could give clarification on this, I had to talk to DEP, I talked to Brett Rowe about this, about deed restrictions being required for a 2-bedroom, because Title V says you gotta, design everything to a 3-bedroom, but you can do a 2-bedroom if you do a deed restriction. But then the question we always get asked is, well, then the lot's 66,000 square feet, why do we need a deed restriction? The answer that I got from DEP is yes, you still need one. So the question was, why do you need one on such a large lot? But they said you still need one, so.
That's because you're designing it, it's under-designed for, if it's 2 bedrooms, right?
Well, it's 2 bedrooms with a 2-bedroom system, so it's designed appropriately.
Right.
But we keep getting the question, DEP says you still need a deed restriction even though the lot size exceeds the 20,000, so that's what we do.
Okay.
Then we have a 3-bedroom repair on a 21,000 square foot lot at 37 University Drive for a Fred and Karen Newton. This one is replacing a cesspool and it will require a deed restriction.
Okay, any questions? If not, I'll take a motion.
Okay, so I move that we endorse the director-approved plans for 615 Adamsville Road with a 2-bedroom deed restriction, and I believe a Concom review is needed as well. And then 37 University Drive with a 3-bedroom deed restriction.
I will second that.
Motion made and seconded to approve those 2 plans. All in favor?
Aye.
That's unanimous. Thank you. Okay, cruising right along. We are moving on to the November 1st, 2023 regular meeting minutes. Any questions or edits, comments from board members?
I had one, I believe on the, at the bottom of page 1, motion. I believe that first one, Pine Hill Road, needed a Concom approval. Which is not written on there. 2 years of total nitrogen testing, let's see.
That's new construction. I don't have my notes from the last time.
I'm looking at mine, Pine Hill. Milk Ave. Is that from the first? No, I'm not finding it on here. Let's see. I'm in the wrong one. Okay, never mind. I could have sworn that there was a Concom review needed for Pine Hill.
We'll make sure that it happens in any case,
Yeah,
even if it's not
yeah.
in the motion. I don't think it's,
Okay, that was it. That's
okay. All right, I'll make a motion to approve the November 1st, 2023 minutes.
Second.
All in favor?
Aye.
That's unanimous. Thank you.
Should I find it?
Okay. It's going to be a record-setting short meeting. Okay, we're moving on to other business. First is holiday meeting schedule. Our next regularly scheduled meeting would be the Monday after Thanksgiving, which the week before is a very short week. The meeting would have to be posted like on Monday. So we're looking at, and then we're getting into the Christmas and New Year's holidays. So Matt, do you have a proposal for how to modify our meeting schedule?
I do. So the meeting after Thanksgiving, which is November 27th, cancel that one. Then the next meeting should be scheduled for December 4th. That's a Monday, 4 p.m. Then the next meeting after that would be December 18th, 4 p.m. It's another Monday. and then skip the New Year's Day meeting, January 1st, and then go to January 8th, which kind of puts us right back on our routine right now with the same flow of Mondays, so January 8th at 4 o'clock.
Okay, so, does that work for board members? I think it gets us out of the tricky dynamic around Christmas, New Year's, both falling on a Monday. Obviously, our workload has been light, so I think collectively we end up skipping one meeting over that 6-week period, which I think is doable. If that schedule works for folks.
I don't have anything conflicting in terms of the time. I don't know when the select board meetings are, if that plays a factor, because our meetings are earlier. But I'm fine with that change.
Yeah, I mean, probably what that means is I'll have, meetings, because Conservation Committee, the Concom meetings are usually the alternative week that I don't have.
Right,
But I don't, but I think we meet early enough in the day that it's not really a problem.
I thought Concom was a Tuesday.
It is, what I mean is that, so.
2 days in a row.
I'd like, well, it used to be 2 night meetings in a row, but now that we're meeting at 4, it's less of a problem.
Okay. It's short term until we
Yeah.
get on the regular
Yeah,
schedule.
So I think it should be okay.
Okay, so I would take a motion to reschedule the November 27th meeting to December 4th, and cancel the 11th and 25th meeting, December 25th meeting, and schedule those instead to be the 4th and the 18th. And then we're back on our regular schedule, so.
So moved.
Second.
Oh, yeah, okay, good.
All in favor?
Aye.
Aye, that's
I was just looking at, we have a Monday meeting on January 1.
Yeah, so we wouldn't have a meeting January 1, so that kind of solves that Christmas, New Year's
Right.
thing. And so there'll be a 3-week period until our next meeting, and then from the 18th to the 8th, another 3-week period, so we sort of space out our meetings without conflicting with holidays and having to move to a Tuesday or another day, so I think that works out well. Great, thank you.
Maybe give you an opportunity if we wanted you to have a working meeting.
Yes, absolutely. Okay, agenda item number 2, under other business, Board of Health and Transfer Station fee review for FY25. I'll turn that over to Matt.
This is just kind of for your information type. I don't have a lot of great detail other than to say that I'm going to stop looking at the Board of Health fees and the transfer station fees. Although we just raised the transfer station fees, I'm not inclined to make any significant adjustments to that, except for maybe I got to take a look at an alternative method for disposing of those smoke detectors, because it's costing us quite a bit of money to get rid of those. So on the Board of Health, I just want to do a fee comparison to some other surrounding towns and see where we're at, make sure we're in line where we need to be. But that's going to be, if we do anything with, food-related stuff, it probably won't take effect till FY25, because we're in the renewal period already for this year. But we'll take a look at other stuff on that Board of Health fee schedule and see if anything needs to be adjusted.
The first, after this January 1st renewal cycle, the next renewal cycle would be equine and piggery. Is it in April or May, right?
Right.
So we have time to, I think if we're going to make any fee adjustments, we should do it early enough in the season that we can give an advance notice, so sometime early in the spring.
Yeah, I'm thinking that, we'll have to take a look at the equine and swine regs, but I'm not thinking we're going to do anything with those fees. More take a look at the septic and the perks and everything related to that, and I may have to reclassify some of the other fees that we have in our schedule because of changes on the state level.
Okay. Okay, well, if anybody has any concerns about any particular fees or anything like that, just forward your feedback to Matt so we can incorporate that in his review.
Were we able to, because one of the things I said was when the Watershed Alliance does their electronics, whether or not smoke detectors is included in that, and whether or
Yeah.
not we can stockpile them until the yearly.
Yeah, so Matt and I talked about that, and so the director there is in communication with the firm that does the household hazardous waste collection to see what the deal might be with that. I don't think she's gotten word back yet,
Okay.
but
so
the
thank you.
information is being
Okay.
sought.
Well, thank you for following up on that.
Yeah.
And yes, we'll factor that into the
Yeah.
calculations. And
Because part of it is the cost is the smoke detectors is part of, because it's a household hazardous waste, because
Oh.
of mercury in there.
Oh,
So
okay.
it's not, so
It's not electronics.
it's
in the
not
typical
totally
way.
electronic.
Yeah,
I mean, it is obviously,
yeah.
you know, it has a bunch of electronics in it, but I think the disposal end of it is, so, but I think that I still think they accept them at the collection day, so.
Okay.
So it might be, you know, so we could do a cost comparison and then also just manage it, like if you would store it and then bring it, we'll figure it out.
Okay,
Oh,
well,
hopefully.
if we can partner with them in some way, that'd be great.
Yeah.
And thank you for following up on that. And we'll keep folks updated on any fee changes in the spring. Okay. Moving on to board member updates.
Yeah, so I've been in further communication with the representative from Bank 5 in Fall River who is a participant in the Mass Housing Authority Low Interest Loan Program, and there was this question about eligibility related to whether the system had to be, the cesspool had to strictly meet the failure criteria under Title V, or whether there was some flexibility about that. And so I asked them that question, and then they actually directly followed up with the representative from the Mass Housing Authority, who then, you know, sent back their response, which I think which I thought I made a copy of, but maybe you have a copy of it. But in any event, said that, oh yeah, you have it here. So the question was, Westport is making mandatory that homeowners convert from cesspools to septic, so not necessarily failed. Will this be okay? And the response was, only those cesspools that exhibit signs of hydraulic failure, which I understand to mean basically that the SAS can't handle the load and so it's backing up. That's what Google told me. So are either hydraulic failure, are located very close to private or public water supplies, or otherwise do not protect or pose a threat to public health, safety, or the environment, will need to be upgraded. And then there's a but, which is, but the septic repair loan program may be able to be used because they are being mandated to convert. So it is possible that all the cesspools would be eligible for the 2.5% loan, depending, assuming they meet the other criteria, the income criteria, et cetera. So, but at a minimum, I think that opened up, or that gave more flexibility than what I had been presented to or understood previously, was that failure was required. And so there's a couple of ways that you know, might help us. For homeowners, that they wouldn't necessarily have to get an inspection if they wanted to apply for the loan, if it was treated as broadly as that. And other things we could, talk about, kind of going forward, at actually how to implement these criteria with the bank and with the applicant. Because, and then it kind of tied into the public information piece that you had provided, in which the Mass Housing Authority website used the terminology either failed or not, or non-compliant. So in this case, it could be that ambiguity is, well, could work to the benefit of the homeowner. It makes it just and we can just, and I think that would happen between the bank and Mass Housing Authority. So I think if we were in a position of answering questions or communicating directly with homeowners about it, I think it would be, I was going to say legitimate, but I think the sensible thing to do would be to have them, if they were interested, connect with the lender and put together the application, and then ultimately, if it wasn't a failed system, there would be a dialogue between the bank and Mass Housing as to what the circumstances were. But we can also, this segues a little bit, which is, so I've, Michael Burrows from the planning department has agreed to generate a map that would map out all the existing cesspools. And then one thing that we could do, at least for, public water supplies, for example, like interim wellhead protection areas, if you want to treat like that, is we could do overlays and see where they were close to. Are they close to a brook? That kind of stuff. So we could because it seems close to private would be, for us, less than 100 feet, or between that area, 50 to 100 feet, where we get to make an affirmative determination as to whether or not they present a public health threat. So I guess the last piece of this is that the representative, whose name is Stephanie, from at least Bank 5, is going to meet with her senior managers tomorrow and open the discussion about whether or not they are going to do an outreach to them. And as I said before, if they agree to do that, then the first step on their part, as far as we're concerned, would be to file a public information request. And then we'd be able to respond to that.
Okay, great. Well,
Yeah, so.
I appreciate you following up on that. It sounds like there's some flexibility there that, as you say, would be welcome to news for homeowners. And so what we are about then ready to do is a second mailing to the 200 plus homeowners who we'd identified had affirmatively had a cesspool, to notify them that the deadline has been extended to February 1, 2028, but also share with them some of the financing options, the tax credit, sort of all the good news on that front that has been percolating, so to speak. So I think we'll be able to get that mailing. We have all the pieces now, I think, that we can prepare that mailing. We have eliminated all those who've already completed their cesspool upgrade. Obviously, they don't need that letter anymore. They've done their good deed and are with the Title V compliant system now. So I think we should take steps to move forward with that mailing. So that's great. All that information is helpful, and we'll proceed on that front.
I have the Shorelines article. a good job of explaining all that except for the title.
Yeah.
Which hopefully people had a good chuckle
Yeah.
when they read
Maybe it
that.
will increase circulation.
I'm hoping so. I'm hoping that people would have said, "What?" and then read it. So,
It was almost as good as the notice about municipal closing. Did you happen to just read the notice of the timing
Oh,
of
no.
municipal closing?
No.
Oh, so it said it was, it said the office is going to be closed from, it was like, from, when, it turned out to be from like Wednesday, the 23rd, you know, until 2023, until Friday of 2019.
yes, there was some, I contacted Ted Hayes about the typo, and he says he's hoping that that would have brought people more attention to the article. It wasn't his intent, but did
Yeah.
you know about the article, about what the title said?
No, I didn't, I don't get the shorelines.
Instead of saying that the cesspool upgrades, it there was a 2-year extension, or it'd be extended for 2 years, it said would be extended for 2 rears. Which we thought was a good humorous
Yeah.
statement,
Yeah,
and I thought, well, that will get a lot of people's attention, but that's not how the title was written. So. There was another thing that I wanted to mention about that, but it slipped my mind. Talking about the shorelines, I'm working on the shorelines column, and my focus is going to be on harm reduction during the holidays. So harm reduction takes on many different hats, wears many different hats for many different things. So I'm trying to weave an article that addresses how do people, to decrease the harm, but still have a good time, still enjoy what the holiday has to bring, but with making some healthier choices or looking out for each other. So,
Great.
so
I'm
hopefully
sure
I'll have that done by the end of the
No
month.
more chainsaw juggling like our tradition at our house.
Well, is that right? I did not know that. And who usually wins that? Because I hate to see who loses that competition.
Great. Well, in the meantime, I think we have that COVID update that we'll see if Shorelines wants to print that.
Oh, and then I had one more thing. I had the good fortune to meet with Olive and the nurses in the collaborative, which was, I thought, a very productive meeting. I shared a lot of mental health resources that they weren't aware of. I shared other agencies that are also in support of and working with the current migrants and some of the public health concerns. And so I thought it was really productive, and I certainly made my my availability and consultation regarding any mental health matters, that I could direct them to where they might get the assistance they need and so forth. So it was very helpful, and the nurses are excellent. They really are. So it was really, I was really glad to make that connection. And Olive is outstanding. You did a good job finding Olive, Matt.
Can't take all the credit, but yeah, she's
She's
good.
really good.
Yeah. The whole South Coast Public Health Collaborative is starting to, take root, and the interaction and collaboration amongst the communities, I think, will build over time and be helpful and constructive for all the participating communities. That's great for Westport too. We get a lot of benefits out of the program. So,
Just in your mentioning Olive, I was thinking about the cesspool list, whether she could keep the list updated as we approve, and I don't know exactly doing approve or installed, but so just kind of keep it current for us.
yeah, it wouldn't be Olive, it would be Gabby, I think.
Oh, Gabby, okay.
And that's something I do on my own. Every meeting I put in, like the ones from this week, I just make notes
Yeah.
in that master database so that we have some level of tracking.
Okay.
But it doesn't track once they're completed. So that's what
Right.
Gabby did, was
Okay.
to verify all the ones that had
Yeah.
a repair plan in place and whether it had been completed, which is how we could
Right.
eliminate some of the people from the mailing list. They didn't,
Yeah.
since they were in compliance.
Yeah.
But that's something that I know Matt has her working on a bunch of projects related to sort of updating our records around all the unknowns and so on. So she's got her hands full.
Okay.
Yeah.
Yeah.
Yeah,
Well, it won't be
that-
happening that often, but it would be good, to know, it would just be good to know that.
Yep.
Yeah, so
I
we
agree.
don't have to.
But it's active in the Google Drive, right? You can go in and see what's been updated right now. She's updating it in real time, so, correct?
We have to figure out a mechanism for her to get information about when plans, like from Pat, basically, when projects are completed and she has them on her spreadsheet. She's now getting data from Nancy when they send IA monitoring, maintenance, O&M to Barnstable County, which is a tracking for all of the IA and D-Night systems, but that doesn't track regular systems.
Right, it
so-
doesn't track the conventional systems, right?
Yeah,
Yeah.
so we have a little more to figure out mechanically around that, but the concept, you are correct, is
Yeah.
something that we need to
Well,
do.
yeah. I
And
mean,
the other
it's-
part
it's
of it-
just, yeah, I mean, it's just a couple of months, really, usually. I mean,
Right,
so that, if we
But-
approve the plan if we want to, if that kind of information, this is an approved plan,
right.
if we wanted to do that. And
The other piece that's, makes it a challenge when you have a static spreadsheet is when properties change hands or there's changes in the assessor records. Because it's a spreadsheet, we can get a new spreadsheet, but all the data's in the old. So having to marry that instead of an active database system, an online database system, which would be sort of bring
Yeah,
us up
integrated.
into the current
Yeah,
decade at least,
yeah,
is, long on the horizon. I don't think that's anytime soon. But we're kludging, we're doing the best we can.
right.
And we did get updated data from the assessor's office, and Gabby's reviewing that as well.
Yeah,
But
good,
that's time consuming. It's not
Yeah.
a very efficient way to run a business,
right,
but it's the best we can do.
yep.
Okay, well, thank you for those updates. The next short-term rental committee meeting is this Thursday afternoon. I can't remember the exact time. It's an odd time, like 2:15 or 1:45 or something. That is, I don't have any, we haven't had a meeting since our last meeting, I don't think. So we'll see where that goes. There's a lot of issues still to be resolved there. And then it would go to the planning board for their review and public hearings and eventually town meeting, should it make it that far.
Let me bring that up. I know that the planning board is looking at, and whether at some point we'll be called to look at that, the school that is,
On Old Harbor Road.
yeah, and that may be something that's going to come up for us to address. It sounds like a residential treatment facility, not a school,
Right,
because it's a time-limited
right.
stay, and they're getting treatment and being educated. So whether or not that's going to have an effect, Matt, I don't know if that has any kind of an effect on the cesspool and how many people are, how many bedrooms.
Well, there's a lot of things that we have to know. We don't know a lot of information.
Right.
We don't know that, what we don't know is how many full-time people are gonna be living there, or how many people are gonna be living there, how many, people are they gonna be bringing there, because that makes a difference on the well. Is it gonna have to be a public water supply or not? Then what's existing there for a septic system? Can it handle what's going in there? Is there gonna be an increase in flow? Is there gonna be a kitchen? If people are living there, maybe they're gonna cook there for everybody. So
Yes.
that's gonna impact things. There's still a lot of information we don't have that we need. And it's been pretty slow on getting that information, so I don't know. The people haven't even come to the health department and reached out to us.
Well, they're still trying to get approval for whatever
Yeah,
they're
well,
doing.
so we get all the when stuff gets scheduled before the planning board, we get a document that I gotta review and either approve, deny, make comment, and, you know, a lot of them that come to us, we have no information on. So I just deny it pending further information, and so they'll go back to the planning board, and the planning board will, you know, so you gotta go to the Board of Health and, you know, talk to them.
Does the designation of what it's called make a difference?
It does in terms of setting the flow criteria. So if it's institutional and it falls under the table of flows, then that's how we would figure, you know, what needs to be there, right? So if it's a, whatever, daycare, each head has a gallon per day flow. But if it's not, and it's some other institutional use, the flow criteria could be different. So we need to know exactly what it's going to be called, what the use is going to be, so we know how to determine the flows.
It's something I'm concerned about because of what people are calling their construction or their these buildings. I know there's another one that's going up that they're calling it a assisted living, but it's individual homes.
Well, it's combination. There's 4 individual homes, and then there's a building that's going to house. It's like a complex.
It's like a condominium.
Yeah,
That's
so
what I think
they're calling it assisted living, but it doesn't meet the criteria of definition of assisted living. So I don't know where if it's going to go anywhere, if it's going to make it past the planning board at this stage.
Yeah.
But as far as I'm concerned, it doesn't meet the definition of assisted living.
No, it doesn't.
And then it takes into account shared systems, because those 4 individual homes are going to be sharing a system with the other complex, or they're going to be sharing a system amongst the 4 individually owned homes. So then that kicks in a whole other thing that we have to look at.
Right, and I know it's not an assisted living, but it's being called that. And so my concern is that are developers calling things something they're not as a way to get around regulations, as a way to get around oversight, that kind of thing. So.
Maybe. We did a preliminary review of what they submitted to the planning board, and there was just a lot of things that we had to question, and we tried reaching out to the engineers, but we never heard back. So
Yeah.
we did a few times, tried to reach out actually.
I mean, I know that the school, what they're describing is what we call in mental health a residential treatment facility, where kids go who have mental health issues, which I'm also in support for, but I'm concerned about the change in the way people are calling things in order to get around what they should be doing. But it is definitely meets what sounds like the criteria for a residential treatment facility. And with residential treatment facilities or assisted living, because I'm a nurse, I know what goes into creating an assisted living and what needs to, and there's regulations and there's governing boards over what's called an assisted living, and they have to be monitored and follow all those regulations. So it's just something that, my ears are perked up because I'm hearing this and I'm concerned about what some developers are trying to do.
Well, I think the first step is generally the planning board, and they're testing the water, so to speak.
Yeah.
And I think they're getting some, they're probably getting a lot of feedback. And when it comes to our role, we'll get pulled in at the appropriate
Yes.
time.
I would recommend to anybody listening that if you do have a project, we got, 4 or 5 projects maybe that are maybe in the planning board, or 3 maybe, or 4, that nobody's come up and seen us. And, it's hard to get any kind of information to anybody unless the people who are proposing the project come up and kind of sit down with us and say, this is what I'm proposing, this is what I want to do. We can kind of talk about it, but they should always come up and see the Board of Health, especially in a town with all private wells and septic
Yeah.
systems.
Yeah.
And if they don't come up and their project gets delayed, well, that's their problem. They should come up and see us.
Well, they have the we just call it the assisted living one, has been in front of the Conservation Commission a few times because the planning board has sent them to the commission looking at stormwater. And so we've kind of weighed in on that, but and just parenthetically, at one of the commission meetings where I raised the issue of shared systems, I think what their response was, was that it was going to be more like a condominium. That is, it's not going to be, I don't know how the houses fit into that. So whether or not it would kind of be like the trust situation that we had, where essentially a single owner of the land, and then people have different housing accommodations, so to speak. You have a single-family house, but the land is owned by, the land is owned by the trust, and it's a single system. So we'll see.
Yeah.
Yeah, as again, I think a lot of it is they're testing the waters to see what they can.
What they can get away with?
Yeah.
Well, yeah, and I just, because I work in healthcare, when I see these things happening, I'm thinking, is there like money available if they call it this? And are they going to be meeting the standards by which an assisted living should be met? Are they going to meet the standards of what would be considered a residential treatment facility?
Well, that's going to be set by the state.
It does get set, yes.
Yeah.
Yeah,
right.
but then there's also some of the public health things that we would have to deal with as well, so.
Well, I'm sure we will be looped in and have an opportunity to weigh in. Okay, anything else? Anything unanticipated, anything else?
Nope.
No. If not, I will wish everyone a happy Thanksgiving. Enjoy your friends and family and good food. Remember, we're closed Thursday, Friday, half-day Wednesday for the Board of Health, half-day Monday for the transfer station, so plan accordingly. And we'll see everyone on December, what did we just say? The next meeting will be?
8th?
No, 4th.
December 4th.
Okay, so then, if there's no other business, then I would want to adjourn this meeting, move to adjourn the meeting at 1:49.
Second.
Motion made and seconded to adjourn. All in favor?
Aye.
That's unanimous. Thank you.